Polio once terrorized the United States, but due to vaccination, wild polio virus has been eliminated in this country. Before polio vaccines became available in the 1950s, polio terrorized the nation in the 19th and 20th centuries, leaving more than 15,000 people paralyzed in the United States each year. Polio changed many aspects of American society, leaving many people confined to iron lungs for the rest of their lives and the way that society approached medical philanthropy. The invention of the 2 polio vaccines was the turning point to one of the most expensive and feared diseases known to medicine, through the expenses and the successes of Salk's killed vaccine and Sabin's live oral vaccine. Poliomyelitis, an acute viral infection that can invade the central nervous system, was one of the most dreaded childhood diseases. Carl Landsteiner was the first person to determine that polio is caused by a virus. He did this by injecting the brains of monkeys with the virus, and when the monkeys developed polio symptoms, he found that there was no bacteria. Polio was a serious infectious disease that primarily affected children, with over 10,000 paralytic cases in the United States. Young children were the most susceptible and the most effective spreaders. Parents became terrified when kids brought home symptoms. As polio progresses, the nerve tissue is affected, causing paralysis and the wasting of muscle tissue. The virus can mutate and strengthen as passed along, spreading in its most dangerous form. Contact with the virus often resulted in mild symptoms. Symptoms of polio include body aches, neck stiffness, fever, sore throat, headaches, or vomiting. There were numerous outbreaks of polio. In 1916, there were over 27,000 cases of polio and 7,000 deaths. Thousands were left paralyzed, the only treatment being physical therapy. Before sanitary measures, children became infected young when the disease was nearly harmless. Children who recovered then gained lifelong immunity. The iron lung was invented by Philip Drinker. It kept the patient in an airtight metal box. The patient's nose and mouth were connected to a pump, which reduced air pressure, imitating inhalation. The decreased air pressure drew air into the lungs. These metal chambers kept paralyzed patients alive. Polio is one of the most expensive diseases known to medicine. In 1939, the National Foundation for Infantile Paralysis began mass distribution of iron lungs, which cost about $1,500 each, the average price of a home at the time. Donors from the Global Vaccine Summit gave $4 billion for a 6-year plan to eliminate polio. Franklin D. Roosevelt, who had a personal struggle with polio, created the March of Dimes, which is also known as the National Foundation for Infantile Paralysis. People sent dimes to the government to fund vaccines during certain months. By the end of that month, the White House received a total of 2,680,000 dimes, or $268,000. The money went directly to the research that enabled Jonas Salk and Albert Sabin to develop their polio vaccines in the 1950s. Salk's killed injectable polio vaccine was the first safe and successful vaccine to be approved. The Salk vaccine, or IPV, was invented in 1955. The virus is grown on tissue from monkey kidneys. 3 important types of poliovirus are grown separately, where the virus would become inactivated over a period of days. The 3 types of viruses are then mixed together and bottled for distribution. Jonas Salk's vaccine became an important tool in preventing the spread of polio. It was recommended that people get an additional dose for protection. There was a 1954 clinical trial for Salk's vaccine on 1.8 million Americans, where the vaccine was then declared safe and effective. After the release and distribution of the Salk vaccine, there was a significant decrease in polio cases, but it did not fully eliminate it. Albert Sabin's oral live vaccine, or OPV, was the second successful polio vaccine. The Sabin vaccine was introduced in 1963, which has a live but weakened form of the polio virus. The live vaccine works because it can replicate and cause immunity and offers longer-lasting protection from 3 types of wild polio. Albert Sabin did pioneering research on polio. He proved that the virus spread through the oral fecal route and multiplied in the intestinal tract. He believed that a live vaccine would offer long immunity because of virus antibodies found in polio survivors. 1 in 500,000 of those who received Sabin's oral polio vaccine got vaccine-associated paralytic polio, but Sabin refused to acknowledge this. Compared to Salk's vaccine, Sabin's vaccine is cheaper to develop and easier to give to children. Polio has since been eradicated in the United States following the development of the two polio vaccines. The successes of Salk's inactivated vaccine and Sabin's live oral vaccine marked a pivotal moment in combating one of the most costly and feared diseases in medical history. The Salk and Sabin vaccines represent monumental achievements in the field of medical science, transforming public health in the United States.